Welcome to your abdominoplasty and body contouring pre-op teaching video. Now, this is a pretty long video and very detailed, but if you watch this a couple of times and absorb this information, I guarantee you are going to know more than just about anybody about your upcoming surgery. So before your pre-op appointment, it's important to get some work done. Were you asked to see a primary care or specialist for clearance? Make sure you get that appointment made and we have the information before your pre-op. If you needed to track down an EKG or if you needed to plan for lab work, this is a good time to start making those plans. Prepare. You're already watching this video, so it means you're on the right track. Read your paperwork and plan ahead. Who's going to be taking care of you? People that might need to help you with childcare or your rides. Don't wait till the last minute to get all these things planned. Also, if it was recommended that you lose weight, did it happen? Is that going to affect planning for your surgery? If you're a smoker, all these surgeries are not safe to do in smokers. So we recommend that you stop at least 6 weeks prior to your surgery. We also know that oral birth control pills or oral estrogen replacement can increase the risk of a complication called a deep venous thrombosis or blood clots. So it is safest to stop these 1 month prior to surgery. And for birth control pills, be sure to use another form of birth control. You can restart these when your activity levels are closer to normal or about 2 weeks after surgery. If you're on a hormone patch, that doesn't need to be stopped any earlier than 1 or 2 days before your surgery. So 2 weeks prior to surgery, it's also important to stop blood thinner medications and herbal supplements. Most common blood thinners are aspirin, ibuprofen, fish oil, and vitamin E. It's also very smart to reduce your alcohol intake. If you drink more than 1 drink a day, I really beg of you to please decrease to 1 drink or less a day for the 2 weeks prior to your surgery. And if you really love your liver, you can stop drinking altogether 1 week prior to your surgery. We know that constipation is a big postoperative problem, so we recommend starting fiber and a stool softener also at about 2 weeks before surgery. Review all your teaching material and please create a question list before your pre-op appointment so we can really be directed in filling in the blanks that you have before your surgery. Also, if you're supposed to bring lab work or an EKG to that appointment, make sure you've got access to that as well. Now, waxing is something that we like to do prior to surgeries like an abdominoplasty, a circumferential procedure like a belt lipectomy or body lift, inner thigh lift, C-section scar revision, or brachioplasty, which is an arm reduction. The reason why is that shaving these areas increases the risk of infection, and hair growth in these areas during the healing phase can become very uncomfortable and annoying. So if you wax 2 to 5 days prior to your surgery, that gives a chance for that skin to kind of calm down again. Some people get very irritated and infected hair follicles called folliculitis. So if that happens to you, which looks like little pimples at the hair follicles, treat it aggressively by cleaning with an antibacterial soap. You can also use hydrogen peroxide and acne wash or acne treatments. Now, we're going to go over a bunch of medications, and it's going to feel like you need a whole pharmacy in your office. But most of these things, or a lot of these things, people already have. So over-the-counter medications that can be really helpful after any surgery are Tylenol, that we'll use for pain, Dramamine or Bonine, which also goes by the generic term Meclizine, which are oral anti-nausea medications, some antacids, Tums or Pepcid are good choices, and some antihistamines. Zyrtec or Claritin and Benadryl are great to have around. We're going to give you this homeopathic medication called Arnica Forte at your pre-op appointment. It helps to reduce pain and swelling and speed healing. It does contain pineapple, papaya, and traces of wheat if you have any food allergies. Typically, we'll start this the night before surgery and continue it twice a day until it's gone. Also, I mentioned earlier about the constipation. So this is kind of our bowel program that we recommend. Fiber and colace for 2 weeks prior to surgery, an enema the morning of your surgery, and it's a good idea to have laxative, and you could use Dulcolax, which is a rectal suppository, or something like milk of magnesia. So if after surgery you haven't had a bowel movement in 4 days, we recommend you use one of these. Now, your prescription medications will be given to you at the time of your pre-op appointment. And fingers crossed, eventually we'll be able to just send these electronically to your pharmacy. So most likely you'll receive an anti-inflammatory, a muscle relaxant, a painkiller, something for nausea. And because of that risk of deep venous thrombosis, many patients will be prescribed a blood thinner. So Tylenol or acetaminophen is our kind of basic pain control for just about everybody. Know that Tylenol comes in two strengths, a regular strength that's 325 milligrams and an extra strength, which is 500 milligrams. We recommend that patients take about 1,000 milligrams 3 times a day for several days after their surgery. Now, there's a limit on how much Tylenol someone can safely take, and that's 4,000 milligrams. So by taking that 3,000 milligrams regularly, it does allow you to take an extra dose if necessary, still staying within the safe range. So this is one of the medications that we recommend you take with a tiny sip of water the morning of your surgery before leaving for the hospital. Celebrex is an anti-inflammatory, and I like to refer to this as a designer ibuprofen because it lasts long, 24 hours a pill, and it causes less bleeding. This is something that you can just take as needed. It's not required that you complete the whole prescription. So the dose is based on your age and your kidney function. If you're under 65 years, you can take this twice a day as needed. But if you're 65 or older, we recommend that you not take it more than once a day. So we start this medication the morning of surgery, typically with 2 tablets or 2 pills that you're going to swallow with a tiny sip of water before you leave for the hospital. If you're under 65, you can restart this 12 hours later. If you're over 65, you'll restart this the next day. Now, this sometimes is not authorized by your insurance company. And because this is for cosmetic surgery, we don't do a pre-authorization, but it is pretty inexpensive. If you have the app GoodRx, you can find where it's cheapest. I actually got my prescription for less than $20 at Costco. Valium or diazepam is a muscle relaxant and also reduces anxiety. If you remember the Rolling Stones song, Mother's Little Helper, this is what they were singing about. So you can take this pill, which we start with 5 milligrams, every 6 hours as needed to relax those muscles and make you feel more comfortable. This is something that is sedating, so you want to stagger it with your narcotic pain medication so that you're not taking too many sedating medications at the same time. So you may take one and a couple hours later take another. Now, you don't want to take this with sleeping pills or other anti-anxiety medications you might already be on, like Xanax or Ativan, because they are the same class of drug. If you use THC, I would also avoid mixing THC with either the Valium or your pain medication. And if you take a sleeping pill like Ambien, don't take the Valium or the pain medication at the same time. Now, this is a prescription that we don't generally refill because of its addictive nature. So if you are needing more than what we prescribed, we'll have to have a little bit of a discussion, but this is one we want you to get off fairly quickly. So next is your narcotic pain medication. And our go-to is typically going to be oxycodone 5 milligrams, which is the same narcotic pain reliever found in Percocet, but we are giving it to you without the Tylenol in it so that you can take your full dose of Tylenol. 1 pill every 4 hours is what your prescription is going to stay. But if your pain is severe, it's okay that you take 2 of them as long as that dosing schedule is not prolonged. Again, you want to stagger this with other sedating medications like the Valium. If oxycodone doesn't agree with you, we do have other options, including Ultram, also called Tramadol, or Dilaudid, which both do not contain Tylenol either. Some people like the Vicodin, which is now called Norco. The only disadvantage of this one is the Tylenol is in it. So you wouldn't be able to take as much of your regularly scheduled Tylenol if you're on Norco, and you're going to have to do a little bit of math. Just so you know, we cannot phone in narcotic refills. We can phone in Ultram, which is non-narcotic, but you would need a written prescription for any refills of this medication. Now, with narcotic pain medication, it is important that you, the patient, decide when you need this, not your caretaker. What we have found is very well-meaning spouses tend to deliver this like, up 4 hours by, here's your pain pill. 4 hours later, here's your pain pill. And they end up really giving a patient far more than they need. We did a really bad disservice to patients by telling them to stay ahead of their pain with narcotic pain relievers. That is what you're doing with the Tylenol and the Celebrex. You're staying ahead of your pain with those so that you need less of this narcotic pain medication. You will not be pain-free by taking this. And our goal is not for you to be completely pain-free. Our goal is for you to be able to get up and walk around, to breathe deeply, and to get some sleep. But it is perfectly okay for you to still have some discomfort because that's you listening to your body to know what activities you should and shouldn't be doing. Now, unfortunately, the narcotics have a lot of side effects. Oversedation, decreased respiratory drive, itchiness, constipation, and addiction are all complications from narcotic pain medication. We're also going to give you a prescription anti-nausea medication called Zofran, ODT. The ODT stands for oral dissolving tablet. So you just need to put this under your tongue if you're feeling nauseated, and it's going to be absorbed. Also, at the hospital, for most patients, they're going to put what looks like a little spot Band-Aid either behind your ear or on your underarm under a piece of sticky saran wrap. This is another type of anti-nausea medication, and it works for 3 days. It also has some side effects that include dry mouth, blurry vision, urine retention, and that's why we don't typically prescribe this for men, and confusion. So we may leave this off of older patients because that is who seems to have more of a problem with it. Now, once you take this medication off your skin, you want to make sure you take a washcloth with soap and water and wash where the patch was, and also wash your hands afterwards. When you throw it away, make sure it's not in a trash can where your pets can get it because they can get sick if they eat this. Also, remember the Dramamine and Bonine that you took the first day of your surgery before you went to the hospital? Those are also very helpful for anti-nausea. Now, the good thing about all of these medications is they can be taken together. If you took one and it didn't work, you can move on to the other. Just as a side note, Dramamine makes you very sleepy. The Zofran does not. Now, I mentioned early the complication of a deep venous thrombosis or DVT, which is a blood clot in your leg. Now, there are a lot of risks to getting a DVT. Surgery is one, and this type of surgery specifically has a higher risk than others. Estrogen hormones that we already talked about with the birth control pills. Immobility, which is really what happens after surgery when you're too sore to get up and move around. Being overweight or obese also increases your risk of deep venous thrombosis. There can be inherited clotting disorders, age over 60, cancer, and smokers all increase the risk for deep venous thrombosis. This can be a life-threatening complication because the clot can break away and go to your lung, which is called a pulmonary embolus. So we are going to do a lot of things to help prevent a blood clot. When you get to the hospital, they're going to put white TED hose or stockings on your legs and these inflatable pumping SCDs called sequential compression devices. It's also extremely important for you to get up and walk around early after your surgery and frequently. We're also going to use a long-acting numbing medication for tummy tucks, belt lipectomies, and body lifts, which will last for about 3 days post-operatively. So it really takes the edge off those first couple of days after surgery so you can get moving early. I also want you to do what I call bed aerobics, and I put this silly picture on here just to remind you. What that means is point your feet, flex your feet, pump your calves, and do ankle circles. Do that all day long when you're laying in bed, and that helps your circulation. We're also going to use medications, which is called chemoprophylaxis. When you are in pre-op holding, they're going to give you one little shot of heparin. And then after surgery, for patients that have risk, we're going to have them use Lovenox, which is a shot you'll give starting the day after surgery. So if you're staying overnight in the hospital, the nurses will help you with this your first day. If you're going home from the hospital and this is prescribed, we're going to go over how you take this medication. So Lovenox is a subcutaneous injection, which means we want it in the fatty layer below the skin, but not all the way in the muscle. Typically, we start this the day after surgery as long as there's no signs of excessive bleeding, and it's given every 24 hours. You never want to give the doses closer than that 24-hour mark. So if you accidentally forgot to do it that morning and you remembered that night, from then on, you're going to be giving that medication at night. You want to continue this until your activities are more normalized or they come in a package of 10. So for some patients, we may stop it before then. It's not required in all patients, but we tend to do it in anyone that doesn't have a contraindication or that we think is having a shorter surgery where the risk is lower. If you read the teaching instructions, they'll always tell you to give it in your abdomen. And if we just operated on your tummy, that's not where we want you to give your shot. Easy areas if you're doing it yourself are the front of the thigh, or if someone's doing it for you, on the side or the back of your upper arm. So you want to pinch your skin before you give this shot, and that does a couple of things. It helps raise the tissue that you're going to put the needle in, but it also, by pinching kind of hard and rubbing kind of hard, it actually makes your nerves fire, so you don't feel that needle go in as much. So I always say pinch hard and put the needle in fast, then you release and you push the medication in slowly. So the night before surgery, you're going to get your NPO orders. And what that means is when you're going to stop eating and drinking. 8 hours before surgery, you need to stop food and full liquids, which include things like milk or lattes or orange juice. But you can continue to have clear liquids, which are things like water, Gatorade, apple juice, tea, or black coffee, or even clear Jello that doesn't have fruit or marshmallows or anything like that in it, for up to 4 hours prior to your surgery. We do know that patients that have a little sugar in their system, and caffeine, especially if you're used to drinking caffeine every day, will actually wake up from their anesthesia feeling better. You can also start your arnica forte the night before surgery, and we're going to have you do your first antibacterial shower with the HibaCleanse soap we give you at your pre-op or an antibacterial soap like Dial. Be sure you know your arrival time and where you're supposed to show up. Make sure your caretaker has also gone over all of these instructions so they know what to expect. And you might get a phone call from your anesthesiologist. A lot of them do try to reach out to you the night before surgery so they can get to know you a little bit. The morning of surgery, we're going to have you do the dreaded enema. The enema is to help empty your bowels if you haven't had a bowel movement the morning of your surgery. After that, we want you to take your second antibacterial shower, and please do not put lotion on the surgical sites. And it's also pretty smart not to wear much makeup when you come to the hospital. Bring easy clothing to get in and out of. Things like a hoodie and sweatpants are a great idea. Your pre-op medications, and again, this may vary from patient to patient, but in general, we recommend that you take 1,000 milligrams of Tylenol, 2 Celebrex, and either 1 Dramamine or Meclizine, that's that Bonine, with a tiny sip of water before you leave for the hospital. Most normal medications are not taken the day of surgery. There are some exceptions, and we'll go over this with your pre-op appointment. These are generally some, but definitely not all blood pressure medications, and things like maybe medications for seizures or epilepsy. What you need to bring with you to the hospital is your ID, your garments, and please have those sitting out for me in pre-op holding because I need to sneak them back to the OR before you. Bring a copy of your paperwork just in case something got lost in the black hole. If you're staying overnight, bring your phone charger, bring your arnica forte, bring 2 or 3 of those Lovenox shots, one more than the nights you plan on staying in the hospital. It's a great idea if you're having a tummy tuck or a body lift or a belt lipectomy to also bring maybe a Spanx tank top or a cotton cami you might want to layer underneath your garment. If you purchased an extra garment in our office, bring that with you as well. And any unique regular medications that you normally take that might be too new and fancy that the hospital doesn't have them on formulary. What you don't want to bring with you are the prescriptions that we gave you in the office for pain control. You don't need to bring those with you. You will use the hospitals. Now, after surgery, you're going to be positioned kind of like in a beach chair position. And if you did have a circumferential procedure, remember you need to baby your backside by kind of rolling from side to side and lifting every once in a while, maybe like once an hour on your backside to help with blood supply. Do those bed aerobics of moving your ankles, pointing and flexing, and take really nice deep breaths. You're going to be given in the hospital an incentive spirometer, and that's what this device is here on the right-hand side up at the top. So you put this tubing in your mouth and you take very, very deep, long breaths. It's important for you to take 10 deep breaths every hour. If you wake up in the middle of the night, that's also a great time to use it. And our goal is that you get over 1,000. Also, it's not a bad idea for you to have a pulse oximeter. In the hospital, you'll be monitored, but this measures your oxygen levels, and you really want that to be above 90%, and you got to work at it. So sometimes it'll drop if your pain control isn't good, if you're not walking enough, maybe you need to unzip your garment a little bit, which is perfectly okay to do when you're just resting in bed, and it's even encouraged. Now, once you get home, make sure you have a caretaker, whether you're discharged from the hospital right after surgery or after you leave the hospital. Your first night home, please don't be alone. Sleep in a comfortable position. Some people find it much easier to be on a couch or a recliner. If you don't have an adjustable bed, you can purchase a couple of wedges off of Amazon, and that can make it really comfortable for you as well. Walk a lot. Work on your deep breathing and your incentive spirometer for about a week after surgery. If you have liposuction as part of your procedure, expect that these areas are going to drain a lot. So you want to protect your linens and upholstery. You can either do trash bags under beach towels, or you could even purchase a cheap shower curtain liner and put it down underneath those towels as well. Remember, if you haven't had a bowel movement for 4 days after surgery, please use a laxative. So I needed to put this super cute little bunny on here because next we're going to talk about drains. Drains are what freak everybody out. The only people who really aren't freaked out by drains are those who've had them before. They're very intimidating, but they are quite easy. So this bulb is what you're going to be emptying and taking care of. That drainage end that's kind of flat and white is what's going to be inside you. We're going to have a dressing on your drain that includes this blue bio patch, and that kills germs, and that's going to be taped against your skin. These white pads with the blue strip on them are called ABD pads, and they will tear very easily along that blue strip, and I recommend you give it about half a tear so that you can fit it around where the drain comes out from your skin, just like this diagram of how that bio patch is. So if this falls off at home, you kind of need to troubleshoot. You don't want to just ignore your drain site because it's a site that can get infected. So you could put some antibiotic ointment on it and a Band-Aid, cutting a slit in the Band-Aid, so the bigger size Band-Aid is better, and you wrap that cut Band-Aid around your drain site. If it's going to be a while before your next appointment, you may want to give us a call and we can get you in earlier to replace that dressing for you. If you've been using the antibiotic ointment, take a shower before you come in to get it off your skin so your next dressing will stick better. So you're going to be given a drain log that's going to help you keep track of how much is coming out of your drains. And if you have multiple drains, which some of these surgeries do, they're all going to be numbered so you can keep their output separate. We recommend that you strip and record the output of these drains at least 3 times a day, and that will be demonstrated at your pre-op appointment. Now, the volume between the drains may vary significantly because they're all sitting in different areas. So don't be surprised if you see that one drain is putting out more. Typically, our cutoff for removing drains is when they're around 25 mLs in a 24-hour period, which is important for us to know what's in your drain log. So bring it with you to any follow-up appointment so we can see what the trend is. I should have warned you about this gross slide before I popped it up there. What's in the drain is going to look different depending on how far you are out from surgery. Initially, for the first couple of days, it may look pretty bloody like this top drain. Then it lightens up and it kind of gets more like red wine and then lighter like cherry juice, which is what I would use to describe this lower drain. This lower drain has barely any blood in it at all. Even though it's red colored, it's very, very thin. You may see it also getting even lighter, about the color of apple juice or kind of golden colored. As it thins, you're going to see some little flecks of white stuff in there, and that is pretty normal. What's not normal about drains is if they fill up immediately and it's dark, thick blood, and that blood almost starts to clot like jello in the bulb and you can't empty it. If that happens to you at home, I definitely need a phone call because that is too active of bleeding. Now, you may see some little white stringy clots or some red stringy clots that come down the tubing into the drain. That's normal. But if it's so much clotted blood in the bulb itself that you can't empty it, that's not normal. Also, what's not normal is if it gets real milky, looking like pus, and it stinks. Sometimes if drains have been in for a couple weeks, they will get a little bit of a white film on the inside of your bulb, and that's normal. But it shouldn't look like pus, and it shouldn't stink. Now, for most patients, it's totally fine to shower the next day, but you have to, what I say, shower with a friend. Your friend in the hospital is going to be your nurse who's going to help you. If you do it at home, make sure somebody you don't mind that sees you naked is there right with you because it's very, very easy to get lightheaded and need some help when you're in the shower. If you have a stool to sit on or a shower bench, that is extremely helpful. You want to make these position changes very slowly. When you unzip your garment, your blood pressure is going to drop a little bit. So I recommend that you unzip it and sit on the side of the bed for a couple minutes before you stand and take the rest of your garment off. Then make sure you're standing there for another minute, getting your sea legs before you get into a warm shower. So you do need to leave all of the tapes that are on your incisions. That coverall tape is fine to get wet, and you want to leave that on your incisions. Also, with your drains, a really great thing is to use a lanyard, or even if you took a piece of yarn and tied it like a necklace, you can hook your drains to that that's around your neck when you get in the shower. Everything can get wet. You might want to leave everything off for a little while after your shower to let things dry, especially your drain dressings, because that area can stay a little bit moist. If you have a hair dryer that has a cold setting on it, you can even use that hair dryer to kind of dry that area off more quickly. I will warn you that you're pretty exhausted after your first shower. So if you're taking it in the hospital before you go home, which I recommend, don't do it right before you're ready to go because you're going to think if you don't get a nap in afterwards, there's no way you can go home. So take the shower at least a few hours before you're ready to be discharged from the hospital. So let's go over your garments and your toppy foam. Toppy foam that's seen underneath this garment here has one side that's kind of sticky and one side that's smooth. So it's the sticky side that goes against your skin, and the goal of it is to keep areas of your garment smoother. So underneath the zippers, like here on the side, and up underneath your breast in the front of the garment are very common areas where we're going to put that toppy foam. So the garments need to be tight, that they're giving you a little bit of a hug, but they shouldn't be squeezing too tightly, making it too uncomfortable. As time goes by, if you want to ditch that toppy foam and you want to put a tank top underneath it, a Spanx or a Yummy Tummy tank top, or even just a cotton tank top can be more comfortable against your skin, and that's fine. You can stop the toppy foam whenever you want to, but we do recommend that you try to use it for about 5 days to 7 days afterwards. I would recommend that you not throw it away right away, because if you go without it for a little while and realize, boy, that zipper is really digging right there and you want to reuse it, you've still got them. So remember again, open the garment when you're sleeping and resting in bed. It doesn't always need to stay really tight, and it can help with your breathing and comfort. So it's okay to unzip it, but you'll find that it's much more comfortable zipped up when you're up walking around. Now, these garments in foam, they're going to get pretty gross. You can wash the foam and hang it dry, and you can wash your garment. You can stay in a robe or something until it's out of the dryer. Some people choose to buy an extra garment at their pre-op appointment, just so they've got something to change into. So your restrictions are that we don't want you laying in bed all of the time, but we also want you to get a lot of rest. Walking a lot throughout the day is great. You should sleep in whatever position is most comfortable for you. And remember, no straining or lifting more than a milk carton. Now, coughing does hurt, but it is good for you. That's the way your lungs re-expand after a surgery like this. So hold a pillow across your tummy when you do, and it can be much more comfortable. Avoid extreme temperatures against your skin. So ice can be helpful as long as it's not directly on the skin, and never use a heating pad. People don't have enough sensation in their abdominal area, and they can actually burn themselves. There's no cardio for 6 weeks, but again, we encourage a lot of walking and no real heavy lifting like a boot camp class or something like that for a full 3 months. So what's normal after surgery is pain. With a tummy tuck and circumferential procedures, most people will complain of the majority of their pain in their upper abdomen just below their breastbone and laterally along their incision sites. It's also common to be very, very fatigued and tired, so get as much rest as possible. There can also be quite a bit of bruising, especially in areas that maybe had liposuction or areas that are more dependent. You'll also see a lot of dependent swelling. So because of your crotchless garment, that means your genitalia, and it can get quite alarming. Also, if you had a tummy tuck and some liposuction, you'll probably notice that your tailbone area is also quite swollen. You might see some swelling in your feet and in your hands. You're going to hold on to several pounds of water weight right after this surgery. So this general puffiness is normal. It's also common to have a little bit of itching because the narcotics make you a little bit itchy and you've got your garment on. Taking deep breaths that make you cough is also very normal, and try to not avoid coughing. I know it hurts to do it. Oh, that's my dog, but you need to cough. So now let's talk about some things that might be concerning. If your drains all of a sudden start dumping a bunch of blood and it starts clotting like I described, or if you're seeing lots more swelling, firmness, and bruising at a surgical site, it could be a sign of a hematoma or excessive bleeding. Low-grade temperatures are common, 99 to 100. That's very common. But if it starts creeping up and getting above 100.8, it's a good idea for you to give us a call so we can run through a few things to see if there's a chance you could have an infection. Rashes are also something that need to be taken seriously because they could be an allergic reaction to a medication. Antibiotics are kind of the bad actors, notorious for causing a rash, but it could be due to your arnica forte or your Celebrex. So the first thing we want to do is stop any medication that could be causing a rash and start quick with those antihistamines I recommended. Zyrtec and Benadryl, as well as the Pepcid, which is the antacid, can all decrease rashes. So we want you to start right away on an antihistamine or 2 or 3 to try to nip it in the bud, and by all means, stop any medication that could be causing it. Oftentimes, we never know what medication it is, and our allergists tell us that it's super common for people to get a huge rash just from being on narcotics. It's the reason why they make you itchy at the beginning, and it's not a true drug allergy, but we don't know, and we have to err on safety. So later, we'll have you meet with an allergist to see if they can figure out why it happened. Now, it hurts to take deep breaths when you have these big surgeries, but what we really don't want is sudden onset of chest pain and definitely shortness of breath. Those are things that we take seriously because it could be a sign of that pulmonary embolus. Also, if you have persistent lower extremity pain or swelling, which is usually in one leg more than the other, that could be a sign of a deep venous thrombosis. Another more subtle finding is for patients that don't normally get headaches to have a bad headache that doesn't go away despite taking pain medication, hydration, and caffeine, which are the main things to help a headache get better. If you have just a nagging headache that lasts a long time, it could be a sign of hypoxia or blood oxygen levels that are too low. So where are you on that pulse oximeter? How are you doing on your incentive spirometer? Do you need to crank it up a little bit? This is something that is also potentially a good phone call or conversation to make sure you're doing all the right things. So it's hard to know when patients can drive. For most patients, it's probably not going to be in the first 2 weeks if it's after a big surgery. You definitely don't want to drive until you've been off your narcotics and Valium for about 24 hours. Use good judgment because your reaction time is really slow, especially if you have some precious cargo in the backseat of your car. At your first follow-up appointment, be sure to bring your drain logs if you have drains in, because maybe we can take them out. Remember that goal of below 25 cc's in a 24-hour period is what we usually use, but sometimes we'll bend that rule. Also, it's a great time for us to ask you questions on how you're doing with your medications, how you're doing with your activities, and what's appropriate. And this is a good visit to also bring what we call second stage garments. So these are options of what you can get into once your drains are out and you're not too sore to pull something on. I like the brand Spanx, but there's lots out there. An important thing if you've had surgery on your abdomen is that you pick one that has shoulder straps, because that garment, if it doesn't have shoulder straps, could roll down and put a band of tension across your abdomen, and that can definitely hurt healing and kill tissue if it's too early after surgery. So initially, the zippered garment that we give you is more comfortable and easier to get in and out of. But once you start wearing your regular clothes again, it's nice to have some options that you can wear, because we do want most patients to stay in compression for at least 6 weeks. If you had surgery with liposuction on your back or your arms or a brachioplasty, you can also find Spanx sleeves and options like that on the internet pretty easily as well. So at your second follow-up appointment, you still likely will need a ride. We are going to remove those incisional dressings at 10 to 14 days. So likely they'll be coming off at your second follow-up appointment. We'll likely still need to continue doing some wound care, but if things are healing up nicely, we can start you on your scar care. We'll also go over what medications you're still taking and, how you're feeling about things and what activities you should be doing. So now you are prepared. You have planned ahead. Bring questions, and watch this video as often as you need to. And don't hide it from your caregivers. You would not believe how much they love you and they want to take good care of you, but they don't know what to do. So by watching a video like this as well, they will be very prepared. Take the time you need to heal, and by all means, please follow your instructions.